In the 1950s, medicine was on the brink of transformation. For decades, patients suffering from kidney failure had no hope. Dialysis was rudimentary, survival was short, and death was often inevitable. Yet, a team of visionary surgeons in the United States dared to imagine a future where failing organs could be replaced, where human life could be extended beyond natural limits. On February 28, 1954, history quietly shifted. In a modest operating theater, surgeons performed the first successful kidney transplant in the United States. The patient, suffering from end-stage kidney disease, received a kidney from a living donor, her identical twin sister. This remarkable match meant that the body would be far less likely to reject the new organ. The surgery was painstaking, the stakes immense, and the outcome uncertain. For hours, the surgeons worked with steady hands and unwavering focus. Each incision, each connection of blood vessels, each careful suture carried the weight of a new frontier in medicine. The team understood that failure would mean tragedy, but success would signal hope to countless patients worldwide. And when the operation concluded, the transplanted kidney functioned immediately. The patient, once facing certain death, now had a chance to live a full life. This moment did not occur in isolation. Behind the operating theater, decades of scientific research laid the foundation. Knowledge of anatomy, immunology, and surgical techniques all converged. The medical community had been studying tissue compatibility, organ function, and post-operative care, preparing for the day when transplantation could save lives. That day arrived on February 28, 1954, and it changed everything. The implications were staggering. Suddenly, organ transplantation was no longer a theoretical possibility, it was a tangible reality. Surgeons, inspired by this success, began exploring kidney transplants with non-identical donors, eventually developing techniques to manage rejection and improve survival rates. Hospitals around the world began building transplant programs, and a new era of medicine had begun, one where the boundaries between life and death could be extended through human ingenuity. Even decades later, the courage and precision of that pioneering team remain a testament to human determination. The first successful kidney transplant was more than a surgery. It was a statement that science could overcome what once seemed impossible. Patients whose lives had been cut short by organ failure could now dream of recovery. Families could hope for renewed health, and medicine could pursue horizons once unimaginable. Today, organ transplantation saves thousands of lives every year. Advances in immunology, surgical tools, and patient care trace their roots back to that seminal operation in the 1950 seconds. It is a story of perseverance, precision, and profound hope, a reminder that the most extraordinary breakthroughs often begin quietly, in a single operating room, on a single day in history. History is not old. History is living inside us. One day, one event, one lesson. Mr. Feedy,